Good morning and welcome to Southern Maine Healthcare's Medically Speaking. I'm your host, Robert Erickson, and for the next 30 minutes, you'll hear about medical issues and topics of the day directly from leading medical professionals at Southern Maine Healthcare. I have two guests today, Louise Beaulieu, a family nurse practitioner and clinical director of physician services at SMHC, and Diane Frechette, a registered nurse and staff development educator at SMHC. Louise and Diane are here to tell us about health literacy, which, put simply, is the degree to which individuals have the capacity to understand basic health information and services needed to make appropriate health decisions. Louise, Diane, welcome.
Thank you for having me.
Thank you.
And we usually like to begin our show by asking our guests how they got involved in healthcare as a career. Diane, maybe you could tell us first.
Actually, I've known ever since I was a little girl that I wanted to be a caretaker. It's by nature, it's my purpose, and I've always wanted to make a difference. And certainly, caring for people and helping people heal, better understand themselves, better medically handle themselves, and have a voice if they don't have a voice, and help them understand.
And maybe you could tell us a little bit more about what a family nurse practitioner is.
So a family nurse practitioner is a nurse who has had advanced training and functions and are called really a provider. They can take care of patients just like a physician does in terms of acute situations, chronic care, teaching. They're able to prescribe, order labs, diagnostic imagings, things like that. So they function in the capacity of a provider. Here in the state of Maine, they can work independently or they can work with large organizations such as Southern Maine Healthcare.
So as clinical director of physician services, what does that entail?
So, we have a lot of physician offices in our organization, so I make sure that the clinical aspects of the offices are running smooth, that the RNs and the medical assistants are getting the competencies that they need, that they are getting the education that they need, that everybody has what they need to do their job to care for patients. I also make sure that the mid-levels, who are the other FNPs, or family nurse practitioners, and the physician's assistants are also getting what they need to do their job so that we're caring for patients well.
And Louise, I haven't asked you yet, how did you get into medicine?
I actually had a similar experience, I guess, as Diane did. I was personally hospitalized when I was 10 years old in a hospital. I was on a pediatric ward. And I watched this little baby who was back then in oxygen tents become very sick, and I was watching those nurses take care of this baby. And over the next few days, I just saw this little baby emerge out of this oxygen tent and be well and pink again and go home. And I remember turning to my mother saying, that's what I want to do when I grow up. And I never lost sight of that.
And you've both been in this field for a while, correct?
Yes, we're seasoned nurses.
Very nice way of putting that, Louise.
Well, we're here to talk about health literacy, and it would be interesting to know how each of you is involved with health literacy here at Southern Maine Healthcare.
Thank you, Robert. This is Diane. I am the chair, actually, of Southern Maine Healthcare's health literacy team, and we work with part of a grant, a federal grant, and that is required through University of New England Geriatric Education Center to build knowledge and health literacy skills to improve throughout the organization. And we've been on this journey for 5 years, and it just opened my eyes as to how very important health literacy is. So this journey has helped increase our understanding and patients' understanding.
And Louise, how about you?
As a provider, I've seen in action what not having health literacy can do for a patient. I mean, I've seen many examples over the years of patients not taking medications well, not taking medications as prescribed, not taking medications, period, because they didn't understand the instructions and they just weren't sure. And because they weren't sure, they just decided not to take it. So, it really speaks to poorer health outcomes and higher health costs.
Louise, could you maybe give a specific example of maybe a patient who didn't understand the instructions for some medication?
Sure. I had a patient who kind of followed up with me, she had seen a provider 3 days prior for an illness and was placed on a medication. And she was told by that provider that she was not allowed to eat while on this eat with the medication. In her mind, she thought she just couldn't eat while taking this medication. She came to me 3 days later having not eaten for 3 days. Now, luckily, she had been drinking. She thought it was important to drink fluids, so luckily she was doing that, but she had not eaten in 3 days. Now, this was a 70-ish-year-old woman. Luckily, she didn't have diabetes where, that became an issue, but it really opened my eyes to, we really need to be careful how we're instructing people on how to take meds, on their disease processes, on all health issues.
Now, I would imagine that there are situations where a patient brings in a family member, and if they've been very ill, and maybe they get a very serious diagnosis, they have cancer or whatever, and maybe they can't hear what you're saying when you're trying to explain. Does that play a role in what you're trying to tell them?
Right. On a normal given day, when you're speaking to people, they only absorb and understand a certain percentage. So, compound that with, we've just given you some really bad news, you suddenly just aren't hearing anything. And so having that extra person there is important. Now, that person may not be, a medical provider or in the medical field and not understand medical lingo as well. But again, even from personal experience, having been in the hospital and, being drugged up on pain medications and being nauseous and not feeling good. And, as a provider, I came home and I looked at my husband and I said, "No, what did they say?" And I feel like I'm, medically I understand what's going on, yet I still had questions. And how do we expect people who are not involved in medicine to even understand if we can't even understand under those circumstances?
Diane, have you seen these sort of situations as well?
Very often, actually. And statistically, about 43% of the nation's adults read at a very basic level. And health literacy starts to decline at age 50. And studies also show that 40 to 80% of medical information patients receive from their clinicians is forgotten actually immediately. And nearly 50% of that information that is retained is incorrect. So when you go in to a health care provider or an organization, your anxiety is elevated. So you're already not listening at a level, and giving these statistics, you're really coming into it at a big disadvantage. And we as providers use this language that is not understandable. To Louise's point, even people who work in the hospitals or in the healthcare field, we walk away sometimes and say, "What was that?" But think of the language that we use on a normal basis that people don't understand. Words like hypertension and cardiovascular. What do those words actually mean? So bringing it to somebody's level, like using plain language, is very important. And yes, I've seen patients return not understanding what they have been given, or coming to me outside of here as a friend saying, okay, because they know I'm a nurse, asking, "This is what I think they said." And I'm thinking, no, that's not what this says on the forms. So, and I've also had personal experiences, much like Louise has talked about, where I was seeing someone with my son, and they would get talking about 3 different medications, and I think if I had a mirror and looked at myself, my eyes were probably bulged open because I was in total awe of not understanding. And I thought, boy, I don't want to ask questions because I don't want to have him feel like I don't know anything, and I'm a well-educated nurse. And I thought, no, this is too important. I need to know that I can empower myself and ask the questions so that I can understand, because the health care of my son was very important. And that's one of the big drivers that we try to push here at Southern Maine Healthcare. And we have a lot of programs in place to try to create that open learning environment so that these errors do not occur.
I think that it's really also important that and I'm speaking to providers at this point, in that if patients are sitting there kind of nodding their heads, that's not a guarantee that they're understanding. They're probably, they could easily be nodding, saying, "Yeah, I really don't know what's going on here." And they are really ambivalent to speak to a provider and say, or to a doctor or a nurse practitioner and say, "I really don't understand this." They don't want to seem stupid. They don't want to seem like they don't understand. So they pretend. They pretend to understand. I think people, particularly people who can't read, really have learn to not show that. And so it's really important. I had one patient, this was very early on in my practice, that I didn't know she couldn't read. And so she came in with very, very elevated blood pressure. And, we waxed and waned whether we should admit her. It was so high. And we decided, I think that if we could just put her on some medication today, bring her back into the office tomorrow, and just check again to see how she's doing and really monitor her very closely. She went home. In hindsight, she never took the medication because she didn't understand how to take it, and she felt it was safer to not take it than to take it the wrong way. She had a stroke that night. Luckily, in the end, she was fine, but it opened my eyes up, and this was within I think, first 3 weeks of me being in practice. So it really brought home the importance of really explaining things to patients in a way that they really, really understand. And then that brings us to teach back. So teach back is a way that we want them to re-verbalize to us the understanding and the instruction that we've given them, so that we can correct, like, no, that's not what I said. This is what I want you to do. And just make sure they're really understanding. I mean, the health literacy has to do with obtaining that information, processing it, and then understanding it. And again, sometimes they're obtaining it, they're processing it in a very different way than we do, and so the understanding on the other side comes out very differently.
Yeah, and I think we all know people, especially elderly people, who may be suffering from different illnesses, and they just don't understand, even if they're literate and maybe they know something about healthcare in general, it's still very difficult for them to understand. How do you make sure that people can understand, especially people who are very ill, can understand these directions?
It's setting that environment of expecting that people are going to ask questions and showing that you have the time. So Louise was saying, tell me how you are going to take this medication, or saying to someone, what, so that I know that I've explained this to you and I've done a good job, could you please tell me in your own words what you're going to go home and tell your significant other about your new medication that we just gave you today? And it opens that platform for them to be able to process it and use it in their own words and teach that back to you. That's why we call it teach back. Or if it's medication, it's the show me method. Show me how you're going to take these pills. Use visuals, use a pill box, whatever works. Make it plain, make it simple. Do the math for the patient. But set the environment so that you expect that they are going to have questions. Listen, I've just given you a lot of information. What's your biggest take back? What do you understand from what I just told you? And that gives us the opportunity to then realize that we haven't done a good job in explaining, or they just didn't process it, or maybe we're using words, again, because we're used to those words, we're using those words that they just can't grasp. So that gives the opportunity to ensure that they walk away and understand and can take the medication safely, can self-manage, can make their next appointments. They can look at a food label and do the math so they know how many carbohydrates they can take.
I mean, even the word carbohydrate, some people have no idea what that is. And for us to say, just you need to watch your carbohydrates, sounds pretty simple, but in essence, it isn't. I mean, we need to explain better. And it's a learning process for providers as well.
Now, why do you think it's taken the healthcare field this long to understand that this is a big issue?
I don't think it's just in healthcare. I have 3 brothers who are engineers, and when they start talking the engineer lingo, I'm lost. So I think it's every realm has their language, and so you get kind of caught up in that, and so you just, again, forget. We've forgotten. And so we just need to remind ourselves that we need to get it to the basic understanding so people are knowledgeable for better care.
I think what we've also seen is increased readmission rates, increased visits to the emergency room, repeat phone calls, missed appointments, poor health management, medication errors. Those are all concrete things that we've noticed that when we dissect down into that, we realize that it's really because of, a lot of it is because of the language we're using and the low health literacy. So I think it's been a process of understanding and looking at the data and figuring it out that, yep, it's health literacy that is the part of the biggest problem.
In this day and age, a lot of us have electronic medical records, not paper records anymore. And, it came to fruition very early on when we acquired our EMR that the instructions that we were printing out on prescriptions was medical language. Telling somebody to take their tablet BID. Nobody knows what BID is unless you work in the medical world. So it's twice a day. But even twice a day doesn't really give you the specifics. Do I do one in the morning and one at lunchtime? Do I do one in the morning and one at bedtime? Twice a day still is not specific enough.
And that's part of our project and with health literacy and going through is in Southern Maine Healthcare. We are working all the time on looking at our patient instructions and reevaluating to make sure that they are in plain language. We are constantly changing the way we write out the prescriptions on the prescription bottles, and we give the patient the little measuring cup with a line on it instead of saying 2 tablespoons or 2 teaspoons. We give that to them and explain that to them. So we're doing workshops on the communication, changing our forms or our brochures. Anything that comes out new now, we look at it from a health literacy level. Is this written at a health literate level?
You're listening to Southern Maine Healthcare's Medically Speaking with Robert Erickson. My guests today are Louise Beaulieu, a family nurse practitioner and clinical director of physician services at SMHC, and Diane Frechette, a registered nurse and staff development educator at SMHC. We're discussing a topic important to us all, health literacy. And we'll be right back after this message about SMHC's walk-in care.
Not every boo-boo is an emergency, but it still feels like one. That's why Southern Maine Healthcare offers walk-in care. You'll find compassionate care at wonderfully convenient locations. Open 7 days a week, no appointment necessary. For those times when the unexpected happens, or you're just not feeling great, look for the orange ball as your sign of the best walk-in care. In Kennebunk, Saco, Waterboro, and Sanford, Southern Maine Healthcare, a member of Maine Health.
And we're back with Diane and Louise from SMHC. We're talking about health literacy. Do you have to approach each patient as though they have low literacy skills, even if they don't?
What we do is we approach the patient as a person, and we're not, that fallacy of if we're going to use plain language, that means we're dummying it down. We're not. We're just making it make sense. So approaching a person using plain language, no matter what, yes, I think we approach everyone that way because we make those assumptions. Louise and I both just gave an example that we are highly educated in the medical field, yet we've walked away saying, what did we just say? What did they just say? So even, especially given our own experience, I think we both approach people thinking that, okay, we need to just make sure that they fully understand no matter what their level, what degree they have, or what their job is. People are people, and when people are sick, you're in a different place, and you need someone that is going to make sure that you fully understand.
So we've talked about specific cases and patients. How are you implementing this through the SMHC system? How, as it cascades through the system, how are you implementing that?
So again, we're changing what's in our EMR so that it is has health literacy in there. Anytime a letter is generated from one of our offices, again, we pass that through to make sure it would be easy to understand for anybody reading it. Any patient instruction, any brochure, any of those things. We just want to make sure that all communication, whether it's verbal or written, is what it should be for understanding for anybody. One of the issues that we see particularly, well, everywhere, but what comes to mind is pediatrics, is measurement of medications. I mean, there's a lot of measuring of medications for parents. I can remember when the little cups that came with even cough medicine would label them as, a gram. I'm like, who would understand that? So again, it's really understand, and then all the different doses that are out there, even in the over-the-counter medications. We frequently give cards out to parents about, acetaminophen and ibuprofen, those typical over-the-counter products, because they come to us and they go, how much am I supposed to give this? And typically those instructions say under 2, contact your physician. So, again, there's a lot of information out there, and it's not to say that over-the-counter medications are less harmful, because they can be very harmful. So that health numeracy, which is what we're calling looking at the numbers in terms of literacy, is very important.
We are continually educating everyone so that this doesn't fall off the grid. We have workshops, we have educational forums, we have monthly education going on in the office practices where the staff and providers, there's actually exercises to do. And it really opens your eyes because, we get complacent in our work environment because we do it every day. So in order to keep this heightened and in the forefront, we have to continually do these things. So yeah, there's those education modules that we do, workshops. Health Literacy Month is a big push. We put out surveys and quizzes where people win prizes, and it makes it fun, yet the people are learning and the outcome has been great.
Obviously, some of these interactions with doctors, it can be a matter of life and death. What do you say to the people out there, especially those who are intimidated maybe by their doctors because they feel like the doctor knows more than they do? What do you say to those folks? What can they do?
So I think, again, at any visit with a physician or the ED or any time they're in that situation, I think just simply saying, okay, so you want me to take one of these in the morning and one of these in the afternoon, just reiterate what you feel they told you for instruction. That way, if there's any misunderstanding, it can happen right then. That way it doesn't open up the situation where, you're saying, I don't understand. But just say, so this is what you want me to do, and then the clarification can happen. But bringing people to your appointment, particularly for the very young, for the very old, for anybody who's really ill and not feeling well, who just can't speak for themselves or would not understand very well, have somebody come with you to your appointment.
And I would also say, ask the questions. Don't be afraid to ask the questions. This is your life. This is your appointment, and you are important. It's okay to say, can you explain that to me again? Because we as Southern Maine Healthcare know that you as the patients are very, very important to us, and we want you to go back and understand and be able to make proper health decisions and be safe. So our environment that we're creating is an environment of expecting you to ask those questions. So yes, it's our job to try to ensure that you as the patient understand, but it's also your job as the patient to say, you know what, I don't understand. So please just ask those questions. What does it mean for me? Are there any side effects? What is my diagnosis and how's it treated? Can you repeat that again? Those types of questions, anything, just ask. Take notes, whatever works for you. Because we want everyone to walk away and be healthy.
Would you say that the healthcare providers are more accepting now of people asking a lot of questions in that regard?
I think very much so. I think patients and everyone have higher expectations of healthcare. And I think that, and they come in with some knowledge sometimes. They've been on the internet, or sometimes they come in thinking they know all of it. And that's where we sometimes have to gauge that and make sure that they don't that they're understanding the proper things. But I think absolutely, I think it has changed. And that's good, because we want people to be healthy. We want them to make safe choices. So we do expect those questions.
Absolutely. We have people come in all the time who have researched their symptoms and come in with what they think is a diagnosis. And then there's certainly a conversation that happens if your diagnosis ends up being a little different than what they thought they had. But they do their research before they come in. They do their research after. I've even said to them, absolutely go out there and read about this, but I just want you to make sure that you're reading it in areas that it's going to give you correct information. So sometimes I'll even give them websites to go to read the information that I know will be correct.
Now, how is it that Southern Maine Healthcare came to make health literacy a priority?
Well, I think the impetus to it was that the Geriatric Center, Education Center of UNE, with their grant, approached our Pat Camary, our vice president of nursing, and said, do you want to start this project? And we jumped on board realizing that, patient safety is our top priority, and we want patients to partner in their health care to provide best outcomes, and knowing that health literacy helps that. It's one of the top drivers in providing that. So we then took off on it, and there's a lot of energy behind this and a lot of effort, and we've been doing it for 5 years, and we're actually a leader in the state, and we were one of the first hospitals to jump on board with this, and we are one of the leaders in the state, and we have state meetings, and we all share, and everyone is quite impressed and take our ideas and go with it. So it's nice that we're able to all collaborate together as a state, because it's everybody's patients, and we find that it has been a great success.
So how has the health literacy initiative been greeted by the doctors and nurses at Southern Maine Healthcare?
I think that for the most part, everybody's really embraced it, but there were some surprising comments at first, one being, well, I already do that. But when we brought up examples, it made them think, gee, maybe I'm not doing that all the time, for sure. And we had one provider even say, well, I think I do it. Again, it's not something that's taught in the medical schools typically. It has been taught in nursing schools for a while. I guess that eventually they will incorporate that into medical schools, and maybe some are already doing that. But it's a new concept for providers. Again, they are taught in medical school to speak that medical lingo, and that's where they're learning the initial medical lingo. It just carries over into that exam room or that patient interaction. And so I think that we do need to make a more valid effort to make that a teaching point in medical schools.
And as we all take care of our patients, we have to switch gears, because we do, as clinicians, use that jargon, so to speak, with each other, because that's how we communicate. That's what we learn. That's what's in the notes. That's what's in the records. We have to switch gears when we're talking with patients and families to use that plain language to make sure that people understand. So we're not using that jargon to someone who doesn't understand that.
Now, we've talked about getting a diagnosis, getting a prescription, and those things, but it also applies to things like publications and signage around the hospital. Isn't that correct?
Very much so. And we are, like I said, any new sign, brochure, anything that goes out, we make sure that it is written at a health literate level, that visually it's good for persons, because as we age, the way we see things is different. So health literacy isn't just about how we talk. It's also about how we can read, how we look at signs, how we are able to be directed within the hospitals or anywhere else.
I recently was looking at a cough suppressant bottle, and I had to run around the house to see if I could find a higher powered eyeglasses so I could read it. So, and I've had patients complain about that they just can't read the writing on the prescription bottles or, on even over-the-counter medication. So again, that's an area that health literacy needs to encompass as well.
Now, where can people find out more information about health literacy?
Well, they certainly can ask some of the providers in nursing here at Southern Maine Healthcare, and our health literacy team can provide some of that. There are some areas online that they can go to. The American Medical Association has a whole big program. The Center of Disease Control, CDC, also has some programs online.
And if there are healthcare providers out there who want more information, can they contact you directly?
Yes, anybody can contact us. Someone can call the Maine Hospital's phone number, which is 283-7000, and they can certainly request to speak to myself, Diane Frechette, as the chair of the health literacy team.
Well, we've run out of time for this week. My guests today have been Louise Beaulieu, a family nurse practitioner and clinical director of physician services at SMHC, and Diane Frechette, a registered nurse and staff development educator at SMHC. Our topic was health literacy. Thanks to both of you for joining us.
Thank you very much.
Thank you very much. I hope this makes a difference. People, we just want you to know, ask the questions.
Join me next week at this time for a new guest and an enlightening discussion about healthcare in our communities, brought to you exclusively by Southern Maine Healthcare, your trusted resource for healthcare in Southern Maine.